It's a great honor for me to be here and to share with you some thoughts that I have concerning the topic and discussion. I had the privilege of sitting here this morning to listen to some of the discussions that went on and just imagining how the world would be like if we had a lot of people sitting together and talking about equity in health and how we can improve public health for the whole world. So that is me up there. And when they talk about the number of years that you have been in health, and listening to about 4 decades, that's a long time, right? And I remember my first day in medical school, and somebody was asking me what I do now. I said, I'm now in public health. My interest was to be a pediatrician. That is what I wanted to do. And I remember our final exams in medical school in Ghana. When I was asked what I wanted to do, I said I wanted to be a pediatrician. And that was the truth. So when we left medical school and I was working, I focused my attention on pediatrics and went on to have a master's in tropical pediatrics so that I could focus on that. But what changed my direction, like we had this morning, and I was sharing with some people during lunch, was when I went into a shop and the lady said, "Are you a medical doctor?" I said, "Do you know me?" She said, "No, but I know that voice because I've heard it on radio." And that made me aware that public health was really important because I was sitting there seeing children, not like you do here. You can go to the consulting room and see about 150 children. And the next month, half of them will come back because of where they came from and where they went back to after they had seen you. So this afternoon, it's a pleasure and an honor for me to share with you some thoughts on how we can build responsive and resilient health systems for universal health coverage, looking at the role of community and primary health care. This will be the outline for the presentation. And I want to start by sharing with us some global aspirations that the whole world has put together. And I'll start with the WHO, where for a long time, since 1948, they have tried to define health as a state, and I'm sure you have learned this probably, as a state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmity. For me, that is key. Now, though this is the definition that we work with, some people think that this has been too vague and too broad, and probably not measurable. Then there's also the issue of public health, which is described as an art and science of preventing disease, prolonging life, and promoting health through the organized effort of society. And I think that this is key, and for me, all these are happening because we want to make life bearable, pleasant, and worth living for everyone so that we could fulfill our aspirations in life, not just as medical people, but everybody else. Now, the WHO Director General continues to look at the definition for health, and he says that their vision remains the same as long ago when it was put together. But he recognizes that the world has changed. And this morning we heard that the world has changed because of all the things that we as human beings are doing, and which is why we have articulated a new vision. They have a new vision, and that is where they are looking at what they can do to be able to keep people on this earth safe and sound for them not to be vulnerable. And so the WHO program of work for 2019 to 2023 looks at these triple billion targets. 1 billion people are benefiting from universal health coverage, 1 billion are better protected from health emergencies, and another 1 billion are enjoying better health and well-being, trying to address the issue of unattainable health as defined in 1948. Now this brings us to what is termed as equity and inequity. And equity is the absence of unfair, avoidable, or remediable differences among groups. And as you go through public health, as you go through medical school, you will realize that there are a lot of inequities. And this morning we have heard some of them, even to the use of ultrasound. In a whole place, there's only one. And the people are not even probably trained to do that. So a lot is going on. So now, which means that health equity is achieved when everyone can attain their full potential for health and well-being. But is that attainable? And health inequities are actually based on systematic differences in health that could have been avoided by some reasonable means. Now, this was shown this morning, and I wasn't aware that my other speaker was going to bring this, but I want to bring this to our attention. So please, it's important that we take time to look at the SDGs, because this is what everyone around the world is supposed to look at and try to shape their health systems to achieve. And usually they talk about SDG 3, and the 8 is saying that we should achieve universal health coverage. And this includes having financial risk protection so that people can access health without being unduly disadvantaged or even impoverished as they do that. Then the big question is universal health coverage, which is what we're going to look at, and look at the role that the community and primary health care can play. So the universal health coverage means that all people, again, all people have access to the full range of quality health services they need at the time that they need that and where they need it. So this is key for us to understand that it is a continuum of care. This morning we saw about the pollution, what happens to the mother when she's pregnant, and even the baby that is unborn. This child will be born with lead poisoning, and that can affect the child's life. Things like that. So it's important that we understand that UHC is firmly based on the WHO Constitution, still of 1948. A lot to unpack over there. Now, as they move forward, the WHO is trying very hard to get countries to appreciate that universal health coverage is key. And so, in 2023, during the UHC Day, the Director General said that on UHC Day, WHO is calling on governments to prioritize investment in building resilient health systems to safeguard the health and well-being of all people everywhere. And this, I'm happy to say, includes the lives of we, the health professionals. Sometimes we leave ourselves out. As we try to offer help, we leave ourselves out. But please remember that this is part of what we also have to think for ourselves. And the importance of that statement is that about 360 million people are in need of such services. And half of the world's population do not even have access to essential health services. And this morning, from what we heard, you can extrapolate from what you heard this morning that there are still a lot of people who need this. And 2 billion people will face financial difficulties if nothing is done. And this means that ultimately, many people will lose their lives if nothing is done. But as we are asked to give health to everyone, we look at this, and I don't know whether you can see this very well, but on the left, you see 2 vehicles, right? And this is a road that in a particular country, they have to pass through. Compare this to the other one, which I'm sure you are familiar with as you drive around. For some of us, this may be the only road we know. We may not have been in a place like this. So if you are talking about people having equal access to health everywhere, we cannot just look at where we are and let it look like it is easy to do that. Now, in the midst of that, we also have all these existing and evolving global challenges, and I'm not going to go through all that. But there are a lot of preventable maternal and newborn deaths. Now, you will read around maternal death, you read around stillbirth, and you know that about 2-something million babies are born dead every year in the world. And that is challenging. We also have a lot of people, population explosion. And then we have huge numbers of young people who are not employed. All these contribute towards health for everyone. And then we have strange diseases, We have communicable and non-communicable diseases. There is insecurity in food, and a whole lot of other things, including displaced populations. So as we look at trying to manage health, we are also confronted with all these existing as well as upcoming global challenges. And please remember that photo before this one, that people everywhere are facing these challenges. And there's also the over-dependence on technology. Even though we know technology can do a lot, there is a lot that is going on with that. And of course, the change in human behavior, which this morning we heard can contribute to pollution and other things. So now we look at what are resilient and responsive health systems that we have to work in and address these challenges for us to have universal health coverage. Resilient and responsive health system. This means that the health system can face shocks and adequately withstand them, both internally and externally, and reduce the burden of disease. And then greatly also reduce the negative consequences of those disruptions and recover and go back to how it was working before. So it's important to appreciate what happens when a system is disrupted. And here you have this showing what happens. So imagine that on the left you have the health system performance, which is not at 100%, but at least it's working. And then you have a shock coming in that disturbs the system. So things go down, that is the red part. But if you have a resilient and responsive health system, it should recover and go up to where we have the green so that we can improve on performance. I showed this graph, again, not to talk about everything, but I guess that we learned a lot from the COVID. I hope we did, because COVID was a big shock. The world was unprepared. Some hospitals shut down. Some of them, it wasn't the whole hospital that shut down, but some parts of it were shut down. There were lack of vaccines. Vaccines were available, but in some places and not in other places. And then we also saw that there was lack of coordination for services. And therefore, it threw a lot of light on our health systems and how they are built to withstand shocks. And it put the health system under so many challenges. And I believe that for a lot of people, they could use the COVID as a way of measuring how strong their health systems were. And this made the role of the public and the community health, as well as the community health workers, more evident and relevant. Again, for some of us, we may be aware of the health systems block. And if you are not so familiar with this, you can take a look at this. And this is said to be what, if it's strengthened, the country can build on its health system and make a change for the population. But for me, there are areas that have not been covered under the photo that I just showed you. And this is where the community and primary health care comes in. So for me, the additional things that need to be added to the health systems blocks are the community health care, the primary health care, and the private sector engagement. You don't see this shown evidently or explicitly with that, and it's key that we do that. So there are challenges that the primary health care and community health can address. One of them is the issue that they have with funding. Funders are there, they want to work in different countries, and we hear a lot of people in global health who say, I want to go to this country or that country. But we have challenges with funding mechanisms. And then there's also the challenge of building a well-trained workforce in adequate numbers. Just as you were doing with the scan, if you have enough people who know how to do this, they will be able to use it. And then there's also the lack of visibility, so people have to advocate for that. And again, importantly, the documentation of what primary health care and community health can do to help people to know that they are actually working. You know, the low and middle income countries are really over-dependent on donors. And unfortunately, that is the situation. We are over-dependent. And this leads to fragmentation in the work that we do and the support that is given. There's also the issue of poor community trust and utilization of PHC and CH services, which means that even if we build our systems and we don't do anything about it, they will prefer to go to the higher level of care than to use this. Now, primary health care is actually a primary care that is a whole of society approach. It doesn't just look at one aspect. And if it is effectively organized, it will strengthen the national health systems and bring services closer to the communities. It's inclusive, it's equitable, it's cost-effective, and it is key to strengthening the resilience and responsiveness of the health system. Ladies and gentlemen, there are three components of the primary health care, and one of them is integrated health services to meet the people's health needs. This is key, because we are not just talking about any health, but we are talking about the health of the people. It's also a way of addressing the broader determinants of health. And I'm sure we are aware that health is not just, as we defined, not just the absence of disease. So there are these determinants. And then primary health care also helps to empower individuals, families, and communities to take charge of their own health. If we want to improve on the health of the people, it's not just about what we do, it's about what the communities are also ready and willing to do, because they have to be involved in strengthening their health care. It's said that if we are able to do this by 2030, this will be a foundation for achieving universal health coverage, because it will be a platform that can help to provide equitable health care, which is cost-effective and therefore not push people into being impoverished because they had to pay for health care. And again, it will help to produce about 90% of essential health services and help to achieve the SDGs that we showed. About 75% of that can be achieved. And importantly, it will help to save about 60 million lives. Can you imagine trying to save these lives? That is important. This is not for you to just read through, but to appreciate the fact that health is complex. So if you are looking at the determinants of health, you have to go through quite a lot to understand what will happen with these determinants of health. I see here that there are missing links. And although countries have made notable adjustments in providing primary health care in pursuit of UHC, and they have also realized that UHC can happen because the primary health care is a cost-effective way of doing that, and we have a huge return on investment if we use community health workers and their program. But they develop UHC systems without integrating PHC and community health into their work and also looking at the monitoring and evaluation. So they are missing the great opportunity to provide essential health services close to clients in pursuit of PHC. Maybe for us here, we may not appreciate so much what communities have to go through to access health, except if you have traveled outside the country and gone to a village like that photo that I showed you, where that is the only road that somebody has to pass through. And you have community health workers living inside that community. That is where you appreciate that it's important to use this as the missing link to achieve universal health coverage. So what can we do to be able to improve on our community health through the community health workers? One, we need that strong government will and support. Sometimes we don't have that. I come from Ghana, and for those of us from Africa who are here, Nigeria and Cameroon and other places would appreciate the importance of having community health workers supported by the government, because some of our systems are different, right? So you may not have one size to fit all. And then financing community health work is key. And Stephanie will tell you when we did this global search, looking at how community health work is financed, there are huge gaps in terms of the funding and what can be done with that. Another thing is about the professionalization and institutionalization of community health. Can you imagine that? Can you imagine you being here? You have to pay for your rent, you have to pay for everything, but you are asked to do things for free. That will not work. Yes, and sometimes this is what they have to go through. We expect them to do some work, but they should do it for free, and that will not work. So there are things that can be done to improve on community health through the community health worker. And then also another thing is to establish primary care networks. Sometimes it's not easy to appreciate what happens. And when Stephanie was talking about me, she spoke about the networks of practice. This is where at the lowest level, you bring health facilities together to function as one. And it's important because they don't have what we have here. The doctor may not be available. We don't have the transport to refer people. We don't have the aircraft to move one person from one place to the other. So it's important that we work together as network. And then there's also the issue of engaging funders to minimize and improve on uniformity. 2 days ago, I was in a meeting, just before I came here, I was in a meeting, and I asked them whether the funders were willing to integrate. And what do you think was the answer? Are they willing? Not really. Because they have their individual areas that they work in. So you can have a funder working in TB, another one working in malaria, another one HIV, another one maybe breast cancer, something. But they are working in the same community, but they are doing their things differently, and they are working with these community health workers. So till we get this to be done, it will not be so easy for us to see that community health workers, community health work, primary health care can help us to build resilient and responsive health systems. The other thing is about research. A lot is going on, but how are we researching into that and sharing the experiences? You know, this morning sitting here and listening to what has been done and people taking time to document it and sharing, it kind of gives you the idea that, yes, if we put a scan machine here, it will help us to save a life. Because the person who had the RTA, road traffic accident, and was bleeding, or the one who had the pneumothorax, something like this, if you were somewhere far away without the scan, this person could have died. And how do we build a system when people are not willing to come together? Or how do we build a system when we do not put our research together to share? So it is important that we do this. Now, last year, Stephanie and I, we had the opportunity of participating in this amazing workshop in Liberia, this conference, and the theme fits very well. The theme, as we see here, is advancing community health worker programs to build resilient and equitable health systems that accelerate expansion, long title, of primary health care for universal health coverage. And this is because internationally, people have realized that if we are to get UHC, the community health worker is key. And you should have seen the people who were there talking about their work with enthusiasm. And they had this call for action, that for investing in community health programs as an integral path to universal health coverage, it is recognized that the community health is the equity arm. Remember the road that we saw. If you were asked to go on this road, would you be happy going on that road? Even if you are the most dedicated doctor in the world, would you want to go on that? Can you use your 4x4 to go on this? Or what are you going to use to travel on that route? So it's been found that that is an equity arm. And that CHWs, community health workers, are essential to global health security, and that is true. And they play a critical role in pandemic preparedness. The COVID showed us that if we had this in place, we may not have reached the level that we got to. Now, it's also seen that if we have this community health worker program going very well, PHC going very well, then there will be a great impact. In 3 main areas, they will be able to reduce on these maternal mortalities end all preventable deaths under 5 years of age, which is very painful, bridge the gap of equitable access, and also bridge the gap in thriving. And at the bottom, I don't know whether you see, but isn't it sad that you sit in a meeting and you say that about 95% of all maternal deaths occur in LAGCs, low and middle income countries, in 2020. And this is not just in 2020, but that is how it has been for many years. And the unfortunate part is that most of them are preventable. So why are we having these deaths? And every country is supposed to help to reduce this by 2030. How many years is that between now and 2030? We are in 2024. How many years? 6 years. And we are supposed to reduce these deaths, which are over, we do it by 100,000 live births, right? And some countries have about 400 per 100,000 live births. Within these 6 years, how are they going to be able to reduce that to the figure that the world is looking at? That is going to be a big challenge. So we cannot just sit and let these figures continue without doing much. So this is just showing us the impact, and maybe later on you can take another look at it, but over 500,000 lives will be saved if we are able to invest in community health. And then 500 million people would have the option to access healthcare within their communities. And we will be able to contribute towards reducing deaths and also reducing malnutrition. So the SDGs are actually things that we can use the community health and primary health care to do, not just the health-related ones, but every one of them, because each of them depend on each other. Now, I love this photo. I don't know whether you can see it, but this lady at the back is trying to climb this. Can you see what is here? This is a water body, and what she's trying to climb is like the bridge. And they are going into the community to give immunization to children. How many of us, without our life jackets, would be happy to jump onto this bridge? You wouldn't. Not many of us will not want to do this, but they are willing. And these are community health nurses. So they are willing to go anywhere to give the care that they need. So how about having them living within the communities so that they don't have to also go through this? Because if you don't know how to swim, and look at the type of water that is here, it's not a clear one that you see in the swimming pool. Even that one can kill you, right? So this one, if you fall, and she's big, so if she falls in there, she'll be in trouble, right? Or this road. And this road is in one of the districts that I worked in, one of the districts in the region that I worked in the Western region. And so I know this place very well. And this was a team of community health nurses who were sent to go and work there. And they were willing to go. They set off in the morning, and these are the roads that they had to traverse to get to where they had been posted to work. And if we are talking about giving resilient health systems and giving responsive health care, then we need to have people who are willing to do this. And so, achieving universal health coverage, the role of the PHC and community health, there are so many things that they can do. The first one is that they can provide essential health services. Of course, they need the right training to be able to do that. They can engage the community, and they can reach them with anything. Any type of health intervention that we want to do, they can do that. And then they can also help to report on emergencies and support response activities. That is key. And of course, the routine ones that we know, where they give care to children and pregnant women. But one other thing they can do is to link the community to the hospital. Maybe you may not appreciate how that is so important, because it's easy, you go to a primary health care here and you are sent to the other place to do whatever. Sometimes we don't have that. So it's important that we do this. And I think that we also have to have some gender equity in this, because most of them are women. most of these community health people are women, and of course to deploy what they do for global and community care. Now again, this is showing us that on the right, you see that the community is ready for them. They are waiting for them. And this is where essential health service can be provided for us to be able to achieve universal health coverage. And they are walking. They don't have a motorbike. They don't have a car. They don't have anything. But they are willing to walk. So you remember the road that the car is. So even if they have a car, look at that road. Now they have to go on that bridge. And then they are willing to walk to these places, which means that the community and primary health care will be essential if we are able to address the health, resilience, and responsive systems. So, this is what I want to leave you with, some points for reflection. In considering primary health care and community health care as helping to build responsive and resilient health systems, please consider that community health should be integrated into primary health care. I say this because sometimes we have a primary health care system, but the community health is not integrated into that. And the two of them should be included as an integral part of the country's Ministry of Health agenda. It's strange. We can have that, and this came up clearly during that conference that I shared with you. It's also important to appreciate that budgeting should be made in such a way that financing for CHW work is part of it, and it is key. Now, also the fact that global opportunities should be created for peer-to-peer learning. And from here, from this conference, I'm heading to Kenya. And we're going to look at financing for primary health care within the primary care networks. I told you about the networks. It's important to do this. So we are doing all this not as a standalone thing, but looking at how together we can help to build a system that will create a responsive and resilient health system. And then there should be accurate documentation and dissemination of PHC and CH contributions. Sometimes we don't have that. So it's not easy to let the politicians know that if you invest in community health, if you invest in primary health care, we'll be able to build responsive and resilient health systems. So that is important. And of course, some of us here are researchers. And this morning, I know that a lot of you are thinking about where to go and where to do your research and the rest. You can also be thinking about how primary health care and community health contribute to responsive and resilient health systems. On the right, as you consider these points, please consider also some of the questions that need to be answered. And some of these can be taken up by some of you as a work that you can do to help to identify what can be done so that we build responsive and resilient health systems through primary and community health care. My hope is that we will not end our global work here, but we will go to countries that are far away from achieving their SDGs, because it's only 6 years away from now. It's over 10 years, right, that they should have done something. MDGs were not achieved by everyone, and therefore we still have a lot to do, and primary and community health will help us to be able to build resilient and responsive health systems to absorb shocks that come into the system. And then, as you look at all these, also consider what are the tools and the architecture that needs to be done. And I'm sure in your reading, you may come across some of these things. In conclusion, I'd like to reiterate that universal health coverage is a human rights issue. And countries are doing a lot within their means to improve on their health, but a lot still needs to be done. Primary and community health care and the private sector. I didn't say much about the private sector because it wasn't the point of focus, but all of them are key if we have to build a responsive and resilient health system. And governments should invest in financing CHW, PHC, and community health. And then partners, donors, and funders should also support countries' efforts. I cannot overemphasize this. I have worked, I worked in Ghana for many years, over 30-something years, and at various levels of care, including the community. And I know what I'm talking about here, that they should support countries' efforts to be able to build an integrated and strong health system so that no one is left behind, as the whole world is seeking to do. Thank you very much for your attention and your time. Thank you.